November 9th, 2012, I found that I was pregnant with my very first baby. Very first pregnancy, first baby. Jaya was her name. Everybody was really happy. I was really happy. So, of course, that pregnancy, I had a big support system. But it was also stressful because everybody had questions and demands and advice, and I should do this and I should do that. So I had family coming in to visit me to make sure I was okay, make sure the baby was okay, and we were good. I think that night my blood pressure spiked again, but I was at the hospital already, so everything was fine. And the nurse came in and said, "Okay, we're gonna prep you so in the next maybe 24 hours or so you'll be giving birth." So I went from like happy, excited to like, "Oh my gosh, I'm about to give birth. Oh my God, this is real." Being a mom, oh, I was so happy. I was so happy. I always did the chest to chest thing with her, so she was always laying on my chest sleep, and her bassinet was right next to the bed. But I was up playing with her, and then she started getting sleepy or she started getting fussy, so I knew it was time for her to lay down. So I was giving her a bottle, and I laid her next to me. So it's her bassinet, then it was my queen size bed, and she was in the bed next to me, and she fell asleep, and I was super tired, and I think the house was quiet, and I ended up falling asleep. So we were asleep. The next morning, I woke up, and I'm just like, I felt really refreshed, like that was weird for me to sleep that long. And I looked over at her, like, talking to her, like, you usually wake me up when you're hungry and you wake me up. So I'm talking to her. When I picked her up, her arm fell over to the side and she was kind of, I don't know, not moving. So I was kissing on her face like I always do, rubbing my nose on her nose and was talking to her and nothing was happening. So at this point, I'm holding her up, talking to her. I'm holding my head to her chest, everything. I realized that she's not breathing. They just said that they couldn't save her. Most of the time, it was just me this pregnancy, and at Moms to Be, it was like I don't know. When I went to Moms to Be, I got comfortable like really quickly, just because I could relate to everybody there, and it was like, okay, I think we all have the same common goal, not to be stressed out, not to be overwhelmed. And some people were first time moms, and some of us weren't, but we're like, okay, this is a very calm atmosphere. It was better. So my support came from being at Moms to Be. I learned how and what to do to relax. I learned how to eat this time without picking out and just, eating whatever, anything, which helped, I feel like, as far as, because when I get stressed out, I eat. This time, this pregnancy, I ate better. Going to Moms to Be once a week, it was like an outlet too. So it was a form of relieving stress, any type of stress that I was holding on to. I was able to talk it out. I was able to relate. I was able to laugh. I was able to give advice and get advice, as well as information on safe sleep that we talked about at Moms to Be. I was already nervous as far as the safe sleep thing and the sleeping because what happened with my firstborn, I wasn't high risk at all. My blood pressure ran high a couple times, but it didn't stay high. It was pretty normal. Because of Moms to Be, I went in way more knowledgeable this time. I had an actual written out plan that I made at Moms to Be. And when I went in for my C-section, I gave it to the doctor. I had copies to pass out and everything. I felt real confident, like I knew what I was doing. This is Jayana. It's the best thing about being a mom. I think every day is just waking up to this baby. Being in the Moms to Be program, I get to link up with other moms. And I learned everybody else's, parenting styles, as well as the other moms being there. They were pregnant with me, so after everybody, once you're pregnant at Moms to Be and you have your baby, you could still come back. Yay! Because when you're in the hospital and you're at the end of that pregnancy, it can get pretty lonely. So coming back is the exciting part because you get to show off the big old bump that you've had all that time being in the program. And then come back and see everybody else's baby too, and it's like, oh, she's so cute, she's so pretty.
When I first found out I was pregnant, I was about 5 weeks, actually maybe 4 weeks. And that was actually a really, really rough time. I love my baby. However, she was unplanned. So it was a big surprise for me. I was really depressed when I found out I was pregnant. God, I'm crying already. I didn't know if I was going to keep my baby, honestly, because me and her father were not together at the time. And it was the best decision I ever made by coming to Moms to Be, because they made me feel like I could do this. My cervix started thinning around 20 weeks. So then after I went back to work, only working 3-hour shifts, maybe 5 days a week, I was taken back off of work. And they were afraid that Layla would come early, and anything before 26 weeks, the baby may not survive. So here's another dark time in my life, but this time I have Moms to Be as my support system. This is Layla Joy Tyler. She was born December 16th, 2015 at 10:09 p.m. And she's definitely a blessing to me. Not thinking I could have children. And like I said, when I found out, I didn't think I wanted to keep her. But when I look at her, there's no way I couldn't have her. Like, there's absolutely no way. Like, she's like the best thing that's ever happened to me. Just knowing that somebody loves me unconditionally, no matter what. Like, I can't do anything wrong in her eyes. Like, that's really huge. Because a lot of times I feel like, especially because I have really bad anxiety and ADHD and stuff, I feel like I'm misunderstood a lot of times. But when Layla looks at me, she doesn't care about any of that. And it makes me feel good on the inside.